as well as the school in terms of making sure that we optimize the health of our preschoolers for you. So, hold on, just accept this. So just to tell you a bit about me, my heritage is from Sri Lanka. My parents and great-grandparents and grandparents are all from the southern province. So from my father's side, we're from Battapol, Elpitia, and Gandhara, and then from my mother's side, we're from Gaul, from Matra, from Murukatiara, and Pangal. So the part of the reason why I was very interested in child health is actually thinking about Sri Lanka and how good Sri Lanka is in their female literacy, because in terms of family planning, Sri Lanka is one of the best family planning programs in South Asia, and a lot of that is due to female literacy. And so I come from a family where they placed a great emphasis on female education, and so part of that was my inspiration for thinking about a career in international child health, because I did my work experience for UNICEF, and there I learned about vaccination programs. And children are much more likely to be vaccinated if their mothers are literate. And so increase the vaccination uptake, that improves the health of children, it improves the health of the nation. And so so speaking to you as parents who are very interested in the health of children and the health of the nation, it is very good for economics. And as you know, Sri Lanka is currently going through quite a tough economic time. So everything that we can do to optimize the economy of Sri Lanka involves our health, and that includes the health of our children. So good on you for all that you do, schools and parents. So my experience is that I was a pediatrician working in an emergency department in one of the biggest children's hospitals in the UK, in Liverpool, called Alderhay Children's Hospital. And this children's emergency department is one of the largest and busiest in Europe, and sees all sorts of presentations. And so what my expertise is actually knowing a little about a lot of things. And so my specialty is in emergency medicine. And so when you come to thinking about the health of children, it's my type of expertise, which will probably come in useful. So just thinking about the context of pediatrics. So pediatrics is the study of children. And what I love about pediatrics is that pediatrics involves anybody from a preterm baby right through to a grumpy teenager. And children develop and grow in so many ways in between. And so that is the joy of being a pediatrician. And so I was asked to speak to you today because you are parents of toddlers and preschoolers. And so just thinking about the age range it's the kind of age between 1 and 5 years old. So this is the kind of age range that I want to focus on with you today. And so I like this photograph because I relate to this picture, is that the older we get, the more embarrassed we are by our parents. And so at this time, you should be grateful that your children are very interested and want you around, because the older they get, the less they get interested in you. So enjoy it while you can. So this session, I don't want to speak too much myself, because what I want to do, I'm much more keen on doing, is getting you to ask your questions so you can, and we can have a frank and open conversation about the issues that you have. So if I ask that, let me speak for the first 20 minutes or so, keep your questions or maybe write your questions down. And then at the end of the session, with some assistance, if you can either write your questions in or we can have a discussion about it. But what I do ask is that if you save your questions until the end after I finish speaking, and then we can have a full-on discussion. So as parents of toddlers and preschoolers, you are in this journey. You've done the challenging baby bit, and your children are now developing into kind of independently mobile, independently thinking children. And so this is the stage that you're looking at. But this journey is fraught with lots and lots of issues. And so the three main topics I want to broad topics I want to cover are the risk of infections in this sort of age group. And the second topic is the kind of, as children develop and play, the kind of accidents that can happen to children. And then finally, thinking about nutrition of this very important rapid growth and phase of development. So those are the kind of three topics where I'll just do a quick whistle stop to with you. Now, when we think about children, I want you to think about those three topic areas and think that children develop using their senses. They want to explore the world using their senses. And I'm sure in Global Footsteps School, that is a very important part about their development in terms of their senses. But unfortunately, with this part of development comes lots of risk factors. And so I want to talk about the immune system. If you think about children and your toddlers and your preschoolers, they will explore the world with touch, putting things in their mouth, breathing, licking, all sorts of things. And so the main thing that I want to think about in infections in this age group is the concept of viruses. So as a pediatrician, anything which causes an infection in children in this age group, toddlers and preschoolers, it is a virus until proven otherwise. And so, of course, we have seen so much in the press now about a very infamous virus called coronavirus, but there are other viruses. There are so many viruses. We think about dengue virus is another important one affecting Sri Lanka, but the virus is an extremely common organism, and there are so many different types of viruses. And I could, talk for days about the different types of viruses, but I just want to give you a general broad understanding about how to manage viral infections in children. So because, as I said, it is a virus until proven otherwise, I want to reassure you as parents is that despite the challenges of viral infections in children, most viral infections are self-limiting, as in they will heal themselves. It is painful and difficult while they heal themselves, but they do resolve. And so as a pediatrician in this age group, when dealing with children with a fever and viruses, my role as a pediatrician is to amuse the parents and to amuse the children until nature heals itself. The vast majority of viral infections do not need antibiotics, do not need cough medicine, do not need anything else that you can get over the counter. The most of it requires tender loving care and a bit of nurturing. So the main aspect and the main cause of concern for parents is management of fever. Most infections, viral infections, will lead to a cause of fever, and fever can be very distressing for parents, culturally and emotionally. And so children with a fever can be and look very unwell. They can be lethargic and sleepy. They can be very grumpy and irritable and crying. They can feel very, very hot to touch. They may even have very cold hands and feet. They may shiver and they may go off their food. So it can be a very, very challenging time for parents when children have fever. It is very important to realize that the fever is actually part of the body's immune response, which is the way that the body has to fight off infection. So although it is unpleasant for the child, it is an important part of that fighting the infection. So what can parents do to manage fever? There can be many things. Of course, lots and lots of rest. It is important to encourage the child to consume lots and lots of fluid. Water is the best thing to do. So offering them cool drinks. Now, I know from many of my Sri Lankan relatives, where they say, oh, giving cold things to children who have a fever is a bad thing. And, I just want to reassure you that in terms of comfort and for the child, cool drinks can help them cool down. So I would argue against that kind of cultural tradition about not giving cold things. Give my child a cold drink if they've got a fever is absolutely fine. There can be medications that you can use over the counter, things like paracetamol, these can or ibuprofen. These can help reduce fever. And so, although the paracetamol, ibuprofen is not treating the cause of the fever, which is the virus, the paracetamol and ibuprofen can help alleviate the symptoms of fever, which can be more comforting for that child. So, keeping them cool, offering them cool drinks, giving Was I muted for a while? This can also help comfort your child during times of fever. So that is the main thing about how to manage a viral infection, managing the fever. Oh, sorry. So, as I said, virus until proven otherwise, all sorts of different viruses can affect the entire body system. And so, again, going back to children of this age, exploring their senses through touch and their mouth and taste and smell, most of these infections, as you can imagine, affect the ear, the head and neck, in particular, ear, nose, and throat area. And so this is why children will always be constantly sniffing, coughing, sneezing, pulling at their ears. It's all in this ear, nose, and throat area. So many parents, particularly in the nursery age group or when children start school, complain, my child is constantly sick. Ever since they started nursery, ever since they started school, they are constantly with fever or coughing or this and the other. This is normal. On average, children will get a viral infection every month, on average. So, and as I said, these viruses can cause all sorts of symptoms. So if we think about the head and neck, it can cause problems with a runny nose, it can cause problems with sore throats, it can cause problems with ear infections. So these are all part and parcel of the child exploring their world. But again, symptom relief, manage the fever, rest, lots and lots of fluids. These will all help the child recover. And most viral infections can last up to 5 to 7 days. And in some cases, certain viruses, even up to 2 weeks. So it is all about having patience and giving your child tender, loving care. So the cough. Again, my Sri Lankan relatives very bothered by cough, and there can be many reasons for a chronic cough, and many people will want a medicine, a cough syrup or a cough this or an inhaler to help solve it. So, a cough during a viral infection is very, very normal. And again, a cough is good because it is helping clear the secretions that are either in the nose, throat, or sometimes in the lungs. So although the cough is irritating for you as a parent, it is an important part of helping the child recover from that viral infection. So again, I'm amusing the parents by trying not to give cough syrup and antibiotics and unnecessary treatments. Tender loving care is the most important. Viruses can also affect the skin, and I'm sure for those parents may have already had a number of rashes that have caused by viruses. So two of the common rashes caused by viruses. One is called hand, foot, and mouth disease, which is caused by a virus called Coxsackie virus. And again, as scary as this looks, a rash affecting the palms and all around the mouth and ulcers in the mouth and on the skin or in the nappy area, this can look very, very frightening. But actually these, again, like many viral infections, a self-limiting illness, and it's just to support the child during this illness. Another common one that you will see is chickenpox. And so chickenpox, as I'm sure you know, starts off as a little red spot, then develops into a bit of a fluid-filled vesicle, and then it crosses over and can be quite intensely itchy. So again, and many of these are self-limiting, and it's just important to keep the child well and comfortable during these illnesses. We all know, we've seen the children with vomiting and diarrhea. So again, virus is another common cause. And so it's really important that, again, no real treatment is required apart from fluids, little and often. Even though children may continue to have vomiting and diarrhea, rehydration is a really important part of this management, and it's important to give small amounts of fluid, little and often. Some of you may have seen children with these sticky eyes or red eyes or pink eyes. Again, this is known as a conjunctivitis, which is an irritation of the whites of the eyes. And again, common cause are viral infections. Again, children rub their eyes and rub their nose and sneeze and cough, and this is something that can spread very easily in nurseries and preschool. And again, the treatment is symptom relieving. They may require some drops, not to treat the virus, but just to keep the area well lubricated, and maybe a patch at night just to make sure that it doesn't get too irritated. So again, these are things that you can get from your pharmacy or chemist, but again, very, very simple remedies required. In some cases, particularly in the preschool or toddler region, you may notice a child may be limping for no apparent reason. And sometimes viruses can cause a bit of fluid around the hip, and we call this a transient synovitis. And you may find a child just be limping for a number of days. Again, just some simple pain relief can help improve this. What I do want to say is that if you do see a child or your child have either a part of their skin or a joint which is very red, very hot, very swollen, and very painful, as in very inflamed, I would strongly advise seeking a medical opinion, as this might be a more serious infection. So very red, very hot, very swollen, and very painful joints or bones should be a cause to seek a medical opinion. So going back to our senses, children are always exploring their world through their senses, but with this comes a possibility of accidents. So this picture actually reminds me of a time when I was in Sri Lanka when I was about 10 at my auntie's house, and she had 3 children under the age of 5, a newborn baby, a toddler, and a preschooler. And I called this the madhouse in Nugegoda. And this picture is not dissimilar. She was cooking, trying to look after 3 children, and my cousin the baby fell out the cot and had a head injury. One of my other cousin pulled on something hot on the stove and burnt herself. It was just fraught with a possibility of accidents. So head injuries in children, very, very common. I'm sure all of you are used to somebody falling over and banging their head. And so the vast majority of these injuries, again, are very, very simple and very easily managed and do not require medical attention. So the times to worry about a head injury are if your child is excessively drowsy for a long period of time, if they have a fit or a seizure after a head injury, or if you notice kind of fluid coming from their ear, or nose or ear after a head injury. So those are the times when I think you should seek a medical opinion. But most of the cases of head injury can be managed very, very simply. A very common consequence of children exploring their world and playing. As you can imagine, burns or scalds can easily happen in the home as part of exploration and even play. So the thing that I just want to highlight is, what can you do as parents if your child has a burn or a scald? And the most important thing is keeping calm and running that burn or scald under cold water for a long time. People think that you just need to run it for like a couple of seconds. No, keep that water running. If that means taking your child's all their clothes off and putting them in water, that is a good thing to do. And of course, the other thing to think about is pain relief, because as we all know, burns are very painful, so it's important to offer some pain relief for your child. Of course, the toddler and preschool are very curious, and if you think about things where you can get access to things that you shouldn't be putting in your mouth. So things like household substances, medications, and things. So it's really important to think about your house and your home and even your school about how we can protect children from dangerous substances like medications that their parents are taking or grandparents are taking, and of course, household substances like bleach and washing detergents. And of course, I'm sure we've all been here. Children like to explore their world, and they put things in their mouth, but they also put things in their ears and in their noses. So foreign bodies like pieces of toys or Lego or beads or jewelry even, I've fished out an engagement ring out of her nose once. These things can also happen. So again, often not dangerous, but still can happen. In the toddler and preschool age group, there is this children like to play and adults like to play with their children by swinging them around by their arms. The other things they do if their children are running into the road or about to approach danger and parents grab them by the arm and pull them back, this can lead to a small bony injury called a pulled elbow. Although it looks very, very scary, it's very easily fixed by just twisting the arm back into position. It sounds horrible, but it's actually very, very simple. But these are things that can happen in the toddler or preschool age. And of course, children, even a very simple fall, twisting an ankle or twisting a leg can lead to a very simple but stable fracture called a toddler's fracture. And so these things can happen, but again, these things heal very, very well, do not require any cast or any operation, but we heal very, very well. So you can see as children developing as toddlers and preschoolers, they are all prone to injury and accident. So again, reminding you again about children exploring their world through their sense of through their senses. I want to talk very quickly about nutrition. So I'm sure you've all been here with the fussy, grumpy toddler or preschooler who doesn't want to eat what they're given. And of course, there is a very funny YouTube clip about Sri Lankan mothers by an Australian comedian. And the joke that the mother does every time is just eat, 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 eat. And I am just see it in all my Sri Lankan relatives that, this obsession with the children not eating. And so I just want to kind of give you my kind of tips for it. So the first thing I want to ask is, and again, this relates to my own personal story, my maternal grandmother continued breastfeeding my uncle until he was 4 years old. And for me, to think that, breastfeeding a child with teeth sometimes sits uncomfortably with me. And she said to me, I knew he was going to be my last one, so that's why I kept breastfeeding him. And so what I wanted to kind of just remind or ask people is, people think that it's nice to continue breastfeeding, certainly into the preschooler, the toddler and even preschooler time. But what I do want to kind of talk about is iron and nutrition. Although milk and breast milk is very nice, it's warm, it's got calories, it makes children feel full and can settle them and keep them happy. From a nutritional point of view, particularly in the toddler and preschool age group, their need for iron is very, very high. They need a lot of iron to produce blood, and they need a lot of iron for bone and muscle development. And breast milk and cow's milk just does not have enough iron to provide that support. So I really want to just give that public health message to say iron-rich foods is important. And if the longer you keep your child on milk in the toddler and preschool, the less likely that they're going to explore eating iron-rich foods. So although breast milk and things are very important in the early years of life, as you approach toddlers and preschoolers, they need iron. So that's the most important message. The important thing about nutrition in this age group is making sure that meals are regular, that there is regular eating. If you compare adults and children, adults can go for long periods of time without eating and long periods of time without sleeping. As you know, children, as part of their development, need regular sleep and regular meals. And so it's really important to kind of think about the timing of meals and know when children need them. So planning your day around nutrition. But it's what they put in their mouth is the important thing. And this is where you as parents are leading by example. And so thinking about the high proportion of fruit and vegetable which need to be in their diet, and the proportion no being 50%. And of course, being in Sri Lanka, a very staple food, rice-based diet, it's important to think that that staple food is a quarter of the plate rather than the entirety of the plate. You know what it's like. And then also thinking about iron and protein. So this is where you as parents are leading by example and in terms of what goes in their mouth. But at the same time, I'm all about children developing their independent thinking. It's important to involve the children in the decision-making process in terms of their food. And and of course, children can't always get their way because they would always choose the sweet and nice stuff. But involving them in decisions can be very useful in terms of getting them to do what you want. Now, I apologize that this data comes from a UK-based research study, but it is, I think that some of the trends might be relevant. It's about portion size. How much do we feed our children? And again, going back to the Sri Lankan mother going, eat, eat, eat. It's really important to think about portion size. And so it is, although within families, it's very important to think about how much you're giving, how often you're giving it, and what you are giving. So it is, quality, quantity. These are all things that you need to think about. And again, this concept about 3/4 of parents are concerned that their child does not eat enough. But you also need to think about on the flip side, are we eating too? Is that driving actually eating too much? The other thing about nutrition is advocating water. Water is the right drink that we need, and of course there are so many things on the market, all these Coca-Colas and all these fruit juices and things like that. And so I remember my grandmother very cleverly always used to describe water as really tasty. She goes, on a hot day, water is really tasty, and that kind of always stuck with me about actually having water as an option, and to, rather than choosing the sweeter or sugary options. And of course, in Sri Lanka, we have a sweet tooth. And so again, there is always the temptation. And what I want to talk about is that it is easy in the toddler and preschool age group to use desserts and sweet things as rewards for things. I'm not saying that don't do this all the time, but I would just encourage not to do it always, because they're like screens and iPads and TV. These type of rewards can actually slowly start to build up and become an easy way out. So I know it's difficult, but I'm just putting it out there. But the other thing to think about development and involving children in their decisions and things, make the portions that easy to digest, particularly for the toddler and preschooler. So make them bite-sized. Perhaps incorporate your more healthy options into things that they find familiar. So like toys, so like Legos or toys or this, that, the other. So this could be a quite interesting way to encourage what your children, what you want them to eat. So I think I'm coming to the end of what I want to talk about in terms of children exploring their world with their senses. But I just want to also think about, and acknowledge that this session is organized by the school, and to think that there are so many people involved in looking after and safeguarding children. And so I represent health. You represent parents, and the school also look after children as well. But also think about all the people who are involved in looking after children, and we all have a responsibility to thinking about their safety and their development and their health. So a big shout out to all of those people who work in safeguarding children. So that's all I would like to say to you all. And so however you'd like to ask questions, I'm happy to ask in person, or happy for you to write questions. And please, no question is a stupid question. Please don't be shy. I'm not one of these doctors in Sri Lanka who will shout at you. So please, just no question is stupid. Just ask.
Parents, please do ask questions. Thank you. Doctor, they're putting it in the chat, doctor.
So I've got, why do kids get into the habit of biting nails? So again, this goes into the whole thing about exploring their world. And so, children from a young age, they start by exploring things using their mouth. And so children will find comfort in different things. And so if you think about, we talk about children being sensory, and different children will get different pleasure or comfort from different sensations. So if we think about, for those children, for those parents who have children who have cuddly toys, for example, that kind of soft, velvety texture is often a comforting thing to hold against your skin that becomes comforting. So the biting of nails, we call it that kind of oral fixation. I have to hand up, I was a nail biter for a long, long time. And so again, we call it this oral gratification, that actually they want something in their mouth, and it's comforting to be kind of chewing on something, that kind of hard crunch of that situation. And it also helps calm them down. So if you notice, children bite their nails when they're bored or perhaps when they're nervous. So again, thinking about those things. So there are many reasons why children would bite their nails. It could be an emotional response to something, boredom or anxiety, but also it's thinking about, the stimulation that they get from biting something hard on their thing. So maybe thinking about ways to try and channel their emotion, anxiety, or boredom into different ways, or even trying to think about other ways of getting to not bite their nails. So yes, the other way is to make sure that you, instead of them biting their nails, make sure that their nails are clipped, so there's nothing to bite. That's the other thing to think about. Hold on. Any tips to deal with fussy eaters? My daughter doesn't get excited by most kinds of food. I have very limited options when it comes to her snack box because she refuses to eat. So again, a very, very common common question. So again, thinking about involvement of the child. So thinking about when you say fussy eater, what do they like to eat? And again, I know that they're going to say ice cream and chocolate and all sorts of things, but it's again kind of thinking about negotiation. When you say limited options, is it in terms of types of food, or I'm not sure what you meant about the limited options. Is that limited options from you as a parent, or limited options about what the child will eat? But again, thinking about how to, being creative or incorporating play, or trying to find foods or things that the child is interested in, as in like, what is your child interested in outside of food, in life? What are they interested in? Trying to incorporate options which kind of maybe reflect that could also, and make it into a game or make it into a story even, that could also motivate them to kind of eat certain types of foods. My little girl is 2 years +1 and still breastfeeding. So she's a thalassemia carrier. I've been trying to stop breastfeeding during the day, but to no avail. What can I do to stop from breastfeeding? So again, a very common topic. I mean, it is, they call this process weaning, as in weaning off breast milk or weaning off cow's milk, and it is a gradual. It is a gradual process, but there needs to be some. It's the parent. There needs to be some strength in the parent to, not to buckle to the pressure of the child to want that breast or breastfeeding. And so, as I said, going back to my grandmother's thing like that, she thought it was easy. It was easier to keep breastfeeding him because she didn't have to have the hassle of this child. I mean, my cousin put Marmite on her nipples when the child wanted breastfeeding. And of course, the child didn't like the very bitter taste of the breastfeeding, of putting them out on the nipple, and then they stopped. So I think there is a combination of you as a parent having the strength, the emotional strength, not to deal with their crying and demanding, maybe thinking of some deterrents, so things like sour or bitter things on the nipple, to think, and then again speak to other parents about what their strategies were. But there needs to be a combination of things. But then, of course, thinking of alternatives, supporting your child in not wanting the breast milk, but trying other foods. So because remember, milk can be very filling on the tummy, and children will not want to eat other foods if they're full of hot milk. Imagine I gave you all a warm milkshake to have in the morning. You will not be hungry by lunchtime. So yeah, so it's really important, giving alternatives, having your own emotional strength as a parent, and deterrence for the child. Is it normal for 3-year-olds to chew on clothes and toys and rubber? So, yeah. So again, this is the reason why I bang on about senses. Children like to explore their world, and very commonly through their mouth. So is it normal for children to chew on clothes? So there is a concept called picker, which is basically where certain children like to chew and even swallow things which are not natural digestible food, so like clothes and toys and rubber. Now, this again, it's a behavioral thing. So we're thinking about ways of discouraging that behavior, or finding alternatives, particularly in terms of food or nutritional food. Those are things to do. So it is a normal concept for children to want to explore different textures and different things. But you know, the older they get, so now 3 going into the preschooler age, to think about distraction, giving alternatives of things they can put in their mouth, and you know, maybe perhaps not normalizing this behavior. So lots of things to do. And iron deficiency, which is anemic and deficient in iron. So again, just thinking about what are iron-rich foods. So green vegetables are a good source. So things like spinach, any green vegetable is a good source of iron. And of course, red meat. So I appreciate that people may be vegetarian, but green vegetables will be a good source of iron. There is, so, and again, the common cause of things is too much milk. Milk will reduce the chance of eating more iron-rich foods. So, you know, thinking about green vegetables and meat are the main sources of iron. So, yeah, absolutely, those are the things to do. Worm treatment. So, so now there are different types of worms. So there, I assume that the worm treatment that you're talking about is something called threadworm. Threadworm are these small white worms that appear around the back passage, around the bottom, and cause intense itching. So those type of worms are called threadworm. And threadworm is it can spread very quickly within families and in nurseries. So it's important to make sure that if there is somebody in the family who has threadworm, the whole family needs to be treated, and all the bedding and towels needs to be hot washed. So in terms of treatment, these are things that you can get over the counter, and so you can get worm treatment. And as I said, it is normally a single dose and then followed by a repeat dose, but it's very important to prevent reinfection that the whole family gets treated for worms. I assume that the worms you're talking about is not hookworm, which is one which causes anemia, and you get in more rural communities. And again, that requires specialist treatment using a medication called mebendazole. But I'm assuming that you're talking about the more common itchy bottom threadworm, and that requires treatment for the whole family, which you can get over the counter. Very good question. Medicine is not needed for cough, but how can we know it's not pneumonia or something more critical? So thank you very much for that question. So yes, I stand by my things that most of these are self-limiting. However, the thing that I would ask you to look for is something called respiratory distress. And what I mean by respiratory distress is that is an indication that perhaps this is a bit more serious. The first thing, the aspect of respiratory distress, is how fast is your child breathing? If you notice that your child is breathing faster than normal, that is something to worry about. If you notice that your child is working harder to breathe, so by that I mean, if you notice that your child's ribs are sucking in every time they breathe, we call this recession, that is something also to worry about. So if they're breathing fast and if they're breathing hard. Another sign of a child working hard to breathe is if this part of their, at the top of the bottom of their neck is dipping in. If you see that kind of child every time they breathe to do that, I would also seek medical opinion. In terms of cough, there can be different types of cough. If you notice a child having heavy, noisy breathing when they breathe in, like it sounds like a very raspy, like every time they breathe in. This is something called stridor. If you hear a child with a really loud cough, which sounds like a dog or a seal, again, this could be a problem that this area is affected. And again, that should be something that you should seek medical opinion for. So it's a very important question. The time that I would seek medical opinion is if your child is breathing a lot faster, your child is breathing a lot harder, so breathing like this and ribs sucking in, or making grunting noises, or finding it difficult to talk, those are the times that I would seek a medical opinion. So that is very, very important. Thank you for that question. We give our 4-year-old daughter fresh milk in the morning and evening. Is it advised to substitute with something else? I'm not saying get rid of milk in total. I think what you are doing is absolutely fine. A glass in the morning and a glass in the evening, that is absolutely fine. But what I would try and do is maybe, as she's now 4, maybe getting rid of one of those, maybe choosing morning or evening. Yeah, because as I said, milk is very good in terms of calorie, but not enough in terms of iron. So my recommendation would be try and get rid of one of either the morning or the evening. Should I be concerned if my 3-year-old son walks on his tiptoes most of the days, but stops without asking to? This is very, very common, tiptoe walking. I think the encouraging thing that you said is that he can do it sometimes and then not do it. So I would be more worried if he was tiptoeing all the time and couldn't walk normally. So I wouldn't worry about it. It's not going to affect his development. In fact, that will help his calf muscle development, but it's not something, this is something very, very common, and was something that he will most likely grow out of. So it's interesting that if you may find that if you stop asking him to stop, he might just stop. So it may be a bit of reverse psychology, and see how that works. Is it normal that toddlers and preschool are touching Lucas' own private areas? So again, going back to this kind of exploration of the world, if you look at the theories of psychological development in children, there are some schools which talk about different parts of the body that children use to describe. So if you imagine babies very early on are in an oral phase. So it's kind of like putting things in the mouth, discovering breastfeeding and things. And then when you kind of get into the toddler phase, it's now the kind of toilet training time. So that's when they start thinking about their bottom and their back passage and things. And so obviously as part of that, using your genitals and to go to the toilet and things like that, that becomes that kind of fixation. That's the part of their world. So it is very normal. And again, thinking about senses, touch and smells, what does the poo smell like? What does the urine smell like? It's coming out of the back passage, it's coming out the front. And it's all part of this normal exploration of the important parts of their development, which is now toilet training. So for me, I think it's completely normal. And also just on that same thing, it is completely normal for male children to have erections, because again, the blood supply is there. It is just a stimulation. It is very normal for toddlers and preschoolers to have erections. So again, that is also very normal part of development. Is it necessary to give any vitamins? It's a very good question. If you, there are many family doctors who say, there is a whole industry about vitamin and nutritional supplementation, but really in our society, there is really no need to give vitamin supplementation if you give a balanced diet. If you give fruit, vegetable, iron-rich foods that we discussed, there is no need for vitamin supplementation. The other thing to think about is sunshine. Now, in a country like Sri Lanka, where there is plenty of sun, and again, this is thinking about cultural thing. In Sri Lanka, everyone's like, oh, is anyone fair or is anybody dark? Stay out of the sun, all the type of things. Sun is good for vitamin D and bone development. So and particularly for dark skin with higher melanin, it is very important that children get sun exposure. So to answer your question, I do not think it is necessary to give vitamins if you give a balanced diet, encourage exercise, and get some sun. My son doesn't like to eat food other than drinking milk. This is my case in point. Only at night. What can we do to make him eat? So again, what I was saying before, leading by example, offer, so again, I'm not sure how old this son is, but leading by example, offering variety, making sure that meals and things are regular, incorporating creativity and play, and again, not using sweets and things as treat, making things a game. You see people finding out what your son likes outside of in his life. Is there a particular game he likes? Is there a particular animal that he likes? Kind of creating food to match those interests. These are ways that you can try and get him encouraged. And again, it's that variety. If you think about food in the different textures, some food is, watery, like soup. Some is a bit more mashed up, soft and moist. So like the kind of dal, paripu, lentils type of thing. Things are more crusty, like the like roast pang, that type of thing. So thinking about different types of textures, thinking about different types of tastes, exploring all of those ideas and just figuring out what they like. I think it's about trying, keep trying lots of different things and trying to engage with their interests. My son used to bite his teeth, like making noises by biting. So it's this kind of, we call this teeth grinding, bruxism, and things like that. It's not something that you necessarily have to worry about, but I would advise speaking to a dentist to see that he's not grinding down the molars so well. I'm not sure how old your son is, but it should be a problem for his non-permanent teeth, because as you know, children have one set of teeth which kind of lasts until about 7 or 8, and then they have a permanent teeth. So at this time, for your non-permanent teeth, grinding the teeth is not going to be a problem. And by the time they get into their permanent teeth, this type of behavior normally winds down. So I don't want you, so thank you, he's 3.5. I wouldn't worry about it at this stage. If he's still doing it at 7, I would speak to your dentist, but I wouldn't worry about it now. My 2-year-old will sing all nursery rhymes, but won't speak or answer. Could it be a speech that needs a therapy? That's a very interesting question. So if you think about speech and language, there are 2 elements. One is receptive, as in, do they understand what is being said to them? And it is clear, so that is one thing. And the other one is the expressive, as in what are they saying? So it seems to you that your 2-year-old is very expressive, so they can sing all that. So they're clearly listening, they can remember, and they can repeat. So in a skill that is normal and good language development. But in terms of not speaking or answering to questions, it is important to think, I'm pretty sure, do you think that they understand? So for example, they may not express an answer to a question, but if you ask them to do something as in following instruction, they might do it. So like sit down or stand up or come here, they may still do it. So there's clearly understanding, but perhaps not expressing. At 2 years of age, this is not an issue to worry about now, but I would see how things go. Often you find this type of behavior in terms of language development common in children who have older siblings or who are surrounded by older children. But I wouldn't worry about this now, but just see whether they understand your commands or instructions when they act on them. Thank you very much for the question. Is medication necessary for a common cold? And my answer is, I am very anti-medication for the common cold. Just honestly, TLC, lots of fluids, lots of rest. And so, I mean, feel free to go to a pharmacist or a chemist to buy something like a nasal spray or this and the other, but my honest opinion is it probably won't do very much. Cod liver oil. So cod liver oil has got certain amino acids in it. Things I have. So again, I'm all about clinical trials, as in, if you did a trial to show if we give this supplement, will it lead to better outcomes? And I am not aware of any trials which say that giving cod liver oil will improve bone or muscle development. So my answer is I don't think it adds any extra benefit. So I wouldn't do it for my child. I'm not saying it's harmful, but is it additionally beneficial? I'm not so sure. My daughter is 3.5. As soon as she wakes up in the morning, she starts to sneeze for a while and then has a running nose. But as the day progresses, it stops. Can I do anything to help her? So this sounds very much like something that we called atopy, which is spelled A-T-O-P-Y. Atopy is the types of conditions that are associated with things like asthma, hay fever, eczema, and allergies. And children under the age of 5 are naturally what we call atopic. They tend to have these kind of runny noses and sneezes and wheezes and coughs and things. What you describe very beautifully is that it's something called diurnal variation, as in it varies with the day. So in terms of doing anything to help her at this age, I probably not. If she just has this small thing in the morning and then it kind of settles off during the day, I would just watch and wait, and as time goes on, this should gradually settle down. If it's becoming very, very problematic at night, perhaps a nasal spray could help, but this is something I would discuss with your doctor. But if from what you're describing, I would just hold off and watch and wait, and I think by the time she reaches school, it will all settle down. Yes, give cold water for fever. When the kid is having fever and cold, is it okay to give? So again, there is a lot of argument and cultural practice about what to do when a child has fever. Some people say don't give anything cold. Some people say give things cold. The reason why I advocate for things for cold water when a child has a fever is that it can be a way to help cool the child down. If a child has got kind of cold symptoms without a fever, I don't think there's any point in giving cold water. But I think the reason why I talk about cold water is that it can be a useful way to help lower temperature. It can be a useful way to help treat a fever. So that's the reason why I say give cold water. I think it is absolutely fine to give if a child has a fever, even with cold symptoms. What do we got here? My baby is now 3.5. Sometimes he still can't talk about, sometimes repeating what we're saying, can sing songs and understand what we're saying. I think it was just the, so I'm not sure what your question is. Is this normal? My baby is now 3.5. Sometimes can't talk much and sometimes repeating what we are saying, but can sing songs and can understand what we're saying. Okay, this still sounds okay within that limit. I think by the time we get to school, I think that will it will start to it should hopefully start to iron out. I would monitor this and see what your child is like by the time they reach school. And of course, in preschool, I'm sure that a lot can happen in 6 months to a year in terms of this speech and language development. Well, it is 5 minutes to go, and I think I've answered all the questions.
Okay. Okay, I'd like to thank Dr. Lalith for having this session. And parents, if there is any questions you couldn't get across due to the time, you can email it to us and we can try to get, whenever Dr. Lalith has the time, maybe he can respond to it. So I'd like to say thank you to the parents for joining and all the questions and all of that. And I'd like to thank Dr. Lalith as well. Okay, that's it. So thank you very much. Have a nice evening, parents. Thank you, Dr. Lalith. Have a nice evening. Bye.